Okay, we
Hi.
are live. Trudy Scott, food mood expert, certified nutritionist, and author of the Anti-Anxiety Food Solution.
And Josh Friedman, I'm a psychologist interested in integrative medicine approaches to depression. I have a new website, Integrative Depression Solutions, and it's at integrativedepressionsolutions.com. And we are at the IMMH conference. It's just wrapped up, and there was a huge amount of information, tons to learn. It was wonderful. What were your takeaways, Trudy?
Well, some of the things that I thought were absolutely fascinating was this booth that is called methyl genetic testing, and you can enter your 23andMe data, and then what you can also do, as well as running the analysis on that, is enter blood work, enter results of organic acid tests, enter results of stool, and it's going to actually show you if your genes are actually expressing and causing problems, because you may have an MTHFR methylation defect showing up on your SNP, but maybe it's not causing you a problem. So this way you can actually determine if it's causing you a problem. And you had shared with me that you've done the training with them.
I did the training with them, and the training was really amazing. So functional medicine looks at how the biochemical pathways of the body are working. This provides you with another layer, which is how are the enzymes supporting those pathways? How are the genes that program those enzymes? And it can provide you with an awful lot of information. And then they have a very simple program you plug your genes into, and it gives you a guide to what kind of supplements might help.
Amazing. So it's really fine-tuning the functional medicine and fine-tuning what might actually be going on with each individual.
Right.
Yeah,
right. It gives you the next layer it gives you the next amount of information, because the genes, the functional medicine actually shows you what's happening, whereas the genetic testing shows you what potentiality might happen.
Right.
So you might have, if you could have the folic acid defect, but your folate could be fine.
Right.
So that was
Cool.
pretty interesting.
Very good. What else did you like?
I went to a lecture on the use of low dose lithium for all kinds of things. It's something that I had known about. Obviously, pharmaceutical lithium is used for bipolar disorder. Low dose lithium can also be used for bipolar disorder. But two things new I learned: that it's incredibly helpful for irritability. So I'm dealing with depression, so it wasn't something that I often thought about for irritability. It's also helpful for situations if you have a parent or a family history or a past history of substance abuse or alcoholism. So that's going to be something I'll take home to my office for sure.
And it's something that I currently use in my practice, and it was with Dr. James Greenblatt. He actually presented on a similar topic last year, and I heard it, and I had been using the low-dose lithium. So low-dose lithium, it's the lithium orotate. We want to be clear about that. 5 to 10 milligrams twice a day is kind of what we're thinking about. And I've had great results with women with insomnia. It helps to stabilize the mood. And when you're using the amino acids, you need a stable mood. You can't have these ups and downs. So the low-dose lithium is really good for that. So I'd like to hear how it goes when you start using it.
I've been using it. So I've used it with some people who have a history of alcoholism, and it's provided stability in their mood, which has been really helpful.
Love it.
Yeah, it's been good.
Great.
What else you got?
So I absolutely loved Dr. Kelly Brogan. We always love her, don't we? She's
She
just
was
really
amazing.
fabulous. And she talked about the issues with all the medications and how she doesn't prescribe anymore. And then she talked about a good paleo diet and getting off gluten and all that good stuff. But some new things that I heard from her was how she loves Kundalini yoga and how she says she loves it because she can't meditate. And I find a lot of my clients have a problem with meditating. So I always say, if that doesn't work, find something that's going to work. And she has found that this Kundalini yoga works. So tell me a little bit about what you know about it.
So I think Kundalini yoga it's quick movements paired with breath, and the breath is very it's very quick breathing. So it easily occupies the mind. So for someone that would have a hard time sitting in meditation, that kind of movement would be helpful. Other kinds of movements, so other kinds of yoga or Tai Chi or Qigong also have movement or walking meditation. So those can be easier practices for stress management to
Okay.
do if sitting completely still is hard.
Okay.
Yeah.
So we Facebook Live here. For those of you that are just joining now, we're at the Integrative Medicine for Mental Health Conference, and it's Trudy Scott and Josh
And
Friedman.
Josh Friedman.
And I'm going to pass the phone to Josh to hold because my arm's starting to kill me. Maybe he'll do a better job than me. Whoops. We just
sorry.
dropped something. A little bit of real laugh here.
Does that help? No.
No, that's going to be interesting.
Okay.
Okay. The other thing that I heard from Kelly Brogan that I really enjoyed was she's using coffee enemas, which I have quite a lot of experience with because the first practitioner that I worked with when I was an intern used coffee enemas for detox for cancer
Right.
and had really good results. But Dr. Brogan was saying how effective it is for phase 1 and phase 2 detox, also helps with bowel
Right.
production, and the part that I really liked is that it helps with medication detox. So this is something that I'm going to be looking into a little bit more, and I'll come back and share more as I learn more.
That's pretty cool. One takeaway I had. So functional medicine can often be like a very complex process of delving into the root underlying cause of symptoms. So things like detoxification pathways or different kinds of infections or things like that. But one of the things that kept on coming through was how something, especially Trudy here gave a talk, and her talk was on amino acids and dietary change and blood sugar stabilization and stress management. And one of the things I heard running through the entire workshop was sometimes it's simple things that can make a huge difference. And so with using amino acids for mood issues, it can be incredibly quick. I just heard, I don't remember what her name was, but there was a psychiatrist who presented at the end, and she talked about how she got into functional medicine, and she was talking about the radical changes she had in her health status from simple dietary changes. So she from stopping gluten and dairy was a huge, big change for her.
And that's
And so
important.
that was really important.
Yeah, we want to realize that these dietary changes and nutrients can have profound effects. I
Right.
was talking to Nicole earlier saying a lot of my clients will say my anxiety or my depression is so severe, I have to have medication. There's no way that diet and nutrients can make a difference. But
Right.
they really can. It can completely transform lives. I remember
Yeah.
you shared a story of someone who got off gluten and
Yeah, I see it. I mean, I see those powerful changes every day where a dietary change or a supplement like 5-HTP or GABA just changes everything for
Yeah.
them. Like it's the one change that like moves things along. It's
Yeah.
quite amazing.
And it's just a matter of finding what that root cause is for your anxiety or
Right.
your depression. It may be low serotonin, it may be gluten, it may be, you may need lithium support, it may be you've got an infection. We heard
Right.
about Clostridia this weekend, we've heard about Toxoplasma gondii, we heard about
Right.
all of these, Lyme disease. Lyme disease can manifest in many different
Right.
ways.
So-
Finding that root cause is important.
And the thing and so what people were talking about was being a clinical detective. So
Perfect.
working collaboratively with your clients and just say, it's going to be a process. We will find the solution, but it's going to take some time to figure that out.
Perfect.
And there's a lot of detective work that can be done with pencil and paper measures, asking questions, clinical interview, and it's putting the person's story together to get to the bottom of what's going on. And so
Absolutely.
sometimes we can do that without testing. So there are a lot of clinicians here, there were doctors here, but neither of us are physicians. And a lot of the work we both do is working with clients to try to figure out what that missing piece is. And sometimes the missing piece can be quite small.
It can.
So I've seen people. So I had a patient who, this is pretty interesting. He had debilitating depression. He had been hospitalized 3 or 4 times, and we did one test, and the test was it was an IgG food allergy test, and he was a weightlifter, and he was doing 5 whey protein shakes a day. and it came up that he was severely allergic to dairy. He stopped dairy, and within 2 days, his mood was back to normal.
Wow.
And I spoke to him recently, and it was like he's been stable and happy for since his mood lifted.